Begin. Enter the room.
Hello.
I think Doctor.
Hello, my name is Oliver Harris. I'm 25 years old.
All right. And how can I call you today?
You can call me Oliver, doctor.
All right, Oliver. How can I help you today, Oliver?
So, doctor, I suddenly had this chest pain, which started 2 days ago.
Okay, I'm so sorry to hear about that. Can you tell me a bit more about your chest pain, where exactly it is?
Yes, doctor, it's like a sharp pain, which is at the center of my chest.
Okay, and was it sudden or gradual?
It started all of a sudden, doctor, and it gets really worse when I take a deep breath, and it it kind of feels better when I'm leaning forward.
I see. Okay, and can you tell me a bit more, like it happened for the first time or happened previously as well?
It happened for the first time, doctor.
And are you currently in pain or it is better now?
I'm still having some pain, but it's bearable.
Okay, and what is the nature of pain? Is it dull pain or sharp pain?
Sharp pain, doctor.
Okay, and does it goes anywhere else, like move towards your shoulder, neck, arm, or jaw?
No, doctor, it's mainly confined to my chest.
I see. Okay, and you mentioned that when you lean forward, it makes it better. Is it right?
Yes.
How about on lying down?
No, doctor, it kind of gets worse when I'm trying to breathe, take any deep breaths.
I see. Okay, okay. And have you tried anything for this pain?
I tried taking some painkillers, but it did not help me much.
All right, okay. Don't worry. You did the very right thing of coming here and asking for help. Definitely, we are going to help you with that, okay? So I would like to ask you a few more questions regarding that. Have you been noticing any fever or flu-like symptoms recently?
So, doctor, I did had a viral flu-like illness 10 days ago.
I see. Okay. And are those symptoms better now?
Yeah, those symptoms are better, doctor, but I'm really concerned about the chest pain.
I understand. Okay. And also would like to ask that by any chance have you noticed any trauma to the chest recently?
No,
Okay. And would like to ask that do you have pain anywhere else in your body, like excessive fatigue, feeling, anything like that?
no, doctor.
Okay. And have you noticed any headache or any dizziness along with it?
No,
Any shortness of breath?
no, doctor.
Okay. Any heart racing?
No,
Any cough?
no, doctor.
Any swelling in your legs?
No.
All right. Okay. Thank you so much for answering all my questions. I would like to quickly ask you that have you been diagnosed with any long-term medical condition?
No, doctor.
Okay. Are you taking any medications on regular basis?
No, doctor.
Are you allergic to any medication?
No.
And do you have a family history of someone with high blood pressure, sugar, any heart conditions?
Yes, doctor. Unfortunately, my father had a heart attack 2 years ago.
I'm so sorry to hear about your this thing. And so how is he doing now?
Uh, yeah, he's okay, doctor, but I'm really worried about myself now, doctor, because
Mm-hmm.
since my father had a heart attack, I'm really worried that I might have a heart attack.
Oh, I understand. I really understand your concern. Your concerns are really valid. But in order to help you better, I would like to ask you a few more questions, and then I will address your concerns. Is it okay with you?
Yes, yes, doctor.
Okay. And let me ask you some questions about your lifestyle. Do you smoke cigarettes?
No, doctor.
Do you drink alcohol?
Yeah, I drink occasionally, like 2, 3 units per week.
I see. Okay. And I'm sorry to ask, but do you take any recreational drugs?
No,
All right. Okay. And do you have any idea what could be the cause of your symptoms?
Doctor, I don't know. I'm really worried that it might be a heart attack.
I see. I really understand that you must be worried, but actually, I would like to quickly examine you. I would like to check your vitals, especially focusing on your blood pressure, temperature, heart rate, oxygen saturation. I would like to do a bedside ECG and a urine dipstick examination. I would like to examine your heart, your lungs, and your tummy as well, and your legs as well. Any findings?
Okay, doctor.
It's posted on the group, doctor. You can check it out.
Okay, just one second. Okay. Okay, thank you so much for answering all my questions so patiently, Oliver, and letting me examine you. After talking with you, after examining you, I'm suspecting that you might be having a condition called pericarditis. Have you ever heard about this before?
2
No,
minutes
doctor.
remaining.
Is this something serious?
Okay, I explained to you that it is basically inflammation of the outer lining of the heart, and as your ECG shows that there are some changes in it, and you just mentioned that you had a recent flu-like illness, so this can lead to inflammation of outer lining of the heart. Basically, we need to do some more investigations to confirm that it is nothing something serious. So that's why we are going to order your cardiac enzymes, troponins, some blood marker, inflammatory markers, ESR, CRP, and the routine labs for you, kidney and liver functions as well, to make sure everything else is fine. But I just want to assure you as well at the same time that it's not something, the symptoms are not suggestive of heart attack. Am I making things clear to you so far?
Yes, doctor.
Okay, but as you have a family history of heart attack, so definitely we are going to do all these exams for you, and if all these labs results are normal, then we will treat you according to the pericarditis, that is simply inflammation of outer covering, and it's a sort of inflammation that happens after a viral infection, right? So we can offer you some painkillers for that, like NSAIDs, ibuprofen, and if your symptoms are still not better, then we can offer you another medicine called colchicine. Are you with me so far?
Yes, doctor.
Okay, and after your lab results are available and it's safe for you to go home, we can offer you some leaflets regarding that, and also would like to safety net that if by any chance if you
Move
develop
on to the
any
next station.
Okay.
I could not explain it.
Yes, that's true. You actually came to the diagnosis a little, towards the end, but good job in actually finding this out. This is an interesting case, especially because it's so close to MI. If you see the ECG, I'm not sure if others can see it. ECG has, if you look at only the ECG, you can see there are some, ST changes.
Yes, yes. In pericarditis, ST changes are in all the leads. So that is differentiating from MI. MI has a few leads, maybe inferior leads, lateral leads, anterior leads. But in pericarditis, in all the leads, we have this ST elevation.
So, yes, absolutely, you are correct, because that is basically inflammation of the pericardial tissue, right? So then all
Yeah.
these changes do come about. But how to differentiate between an MI? So what happens in an MI is basically there is a loss of blood supply. So
Yeah, exactly.
blood supply, you would be wanting to see where the loss of blood supply is. Suppose if you have
Mm-hmm.
a loss of blood supply in the inferior lead, so there is an inferior infarct, there will be reciprocal changes on the, absolutely the opposite leads. So if you have AVF2 and 3 showing an ST elevation, there will be an ST depression in 1 and AVL. So that's what you're supposed to look for, any reciprocal changes. And you're correct that there will be like throughout, there will be some ST elevation usually in, pericarditis. But then again, it could also mean that the entire heart could also be involved in that infarct. right? Very unlikely, but usually in an infarct, what you're looking for is reciprocal changes. All right. So keep that in mind. And definitely the history itself was very indicative, and the age was also very indicative of it being something other than an MI. So those are a couple of clues that you can keep in mind, all right, when you're actually thinking the difference between MI and pericarditis, especially because if you have an ECG and they might have an ST elevation. In fact, if you do troponin, you will actually see that there'll be high troponin even in case of pericarditis, because due to the inflammation, all the troponin that is actually stuck, trapped in the tissue of the heart, they also come out into the circulation. So yeah, that would actually be a false positive for MI. All right, so good job on this. You were able to come to the diagnosis. You were able to ask a lot of good questions. Just that you ran out of time towards the end. So that is something that, you know this case so well that can actually penalize you towards the end, because you asked a lot of history, then even though you knew the diagnosis, I think you got the diagnosis as soon as she said that if she leans forward, she gets more pain. Is that something that kind of helped you in making the diagnosis, doctor?
Yes, exactly. Yes, exactly. Yeah, history is very suggestive. Very right. Yeah.
Right. So, then you went on to rule out a lot of differentials. I know you would definitely want to rule out MI, and you did ask a lot of good questions for that, but you already kind of got your diagnosis, right? And you would want to go into management soon, because that's exactly where you lost out time, and because of that you would actually lose out some crucial marks. If you personally feel that you haven't asked enough of diagnosis and you feel that you may get penalized for that, you can bring it in your management on how you think it is MI. Because one of the, I'm sorry, how you think it's pericarditis. Because one of the questions this patient had was, could this be MI because my father had, heart attack? Could this be heart attack? So you need to address that fact. So you can talk about all the positive symptoms that you got in suggesting that it's not an MI, right? So you say that it does not really look like the MI because the pain that you are coming with is not very suggestive, and also you are 25, and it's usually not very likely to see it in such young age, especially since you don't have any medical condition or family history of cardiac death at a young age. Because there are some cases of sudden cardiac death that can occur at young age. So you can't completely say that it can't be, you're not a risk, but you don't have anything suggesting that you are at risk, right? So you can actually bring that in, if you want to emphasize on the fact that, yeah, I got my diagnosis, I especially got my diagnosis by the symptoms that you were saying, right? That's actually a good way to actually show that, from what you have told me, the pain that you're experiencing is more consistent with something called pericarditis, this condition. And especially since you mentioned that you had a viral fever 2 weeks back, that is something that is giving me a very strong inclination towards this diagnosis. Those are the ways that you can explain it, because that's how we all know it, right? Like there are these evidence-based, what you say, facts that we know. So you can actually bring that out. So good job. I think Dr. Anote has marked. So we'll just quickly look at the marks. All right, data gathering. Oh yeah, you got like full for data gathering. Good job. Yeah, since you had an ECG, you can actually explain the ECG, but that's all right. And PR depression is also an important ECG finding when it comes to pericarditis and differentiating between pericarditis and MI. Reciprocal changes, and this one will have PR depression. Both have T-wave inversion, so that's a different story. And ruling out, you did a lot of this. I think you did almost everything. And ice beam afters, good job on that. All right.
I'm sorry, sorry to interrupt you. I cannot see your screen. You're sharing. So how many marks I got? I cannot see the screen. I don't know why.
So data gathering, you got full marks. You have 4 out of 4. There are no points that have been missed. You know what? We'll just put a screenshot of your data gathering, management, and interpersonal skills.
Yeah. Thank you so much. Thank you so much. Yeah.
Yeah. I'll just discuss it for everybody else who can see the screen. So management, you got 3. And the points that you did not cover was follow-up and giving leaflets and pamphlets. I think you were coming to that, but then towards the end you lost time. But no worries, you actually did manage to say almost everything. So what else can you say if you did have time? So sometimes she did mention that she takes she's taken painkillers and it's not worked. Right, so you can take it one step higher. We can escalate the painkillers. We can give you a little bit stronger ones, yeah, because you want to make sure that she's pain free, because the presenting symptom was pain, so you want to try to make her pain free. But Dr. Mishi, actually in this scenario, I actually mentioned that the patient was not taking any painkillers, but that's all right. I mean, the scenario can come in any way. Right, you never know, she might be actually taking painkillers, so be prepared for anything. If that is the case, then how would you manage it, right? So it's good to see variations. So colchicine, if not contraindicated, definitely. Sometimes we have to give steroids to reduce the inflammation. That is something that you can say in the future, that if this also doesn't work, then we can try something as strong as something like a steroid, right? And you can just mention some complication where the pericardium might end up sticking to the heart and it can cause some restrictive cardiac disease. So that's something that, if you have time, you can safety net for that, but MI is good enough to safety net. That is like a sequelae or complication of very complicated pericarditis, but that's all right. But that's again if time permits, but that's fine. Interpersonal skills, again, you got 3. So only thing was summarize information back to the patient, understanding. But yeah, I think I wouldn't penalize much for that. But good job. That was actually a very well done station. Good job, Dr. Savan.
Thank you so much, Dr. Ann. It's all because of you, You have boosted our confidence as well. And, really thank you so much for all these sessions. They're really helpful.
All right. Oh, thank you so much, actually. So basically, that's exactly what I'm trying to bring out in everybody, that, you guys, you all know the stations, you all know the scenario, you guys are all doctors. So you need to put in your clinical judgment into doing the cases. And, everybody, they have a certain understanding of things. So use that understanding. And that's what is important. Right, you need to ultimately use your understanding in making clinical judgments, and yeah, that's what we're trying to promote. We are trying to critically think every information that we know, and we're going to deliver. So your inputs have also been immense, so thank you so much.